Good morning. My name is Greg Heffernan. I'm Vice President of Academic Affairs for Residency Medical, and I want to welcome our viewers to this webinar. If you didn't match, there is still hope for 2024. And we're going to talk about how that can be possible and some strategies. And I've got two wonderful guests that are going to help us out with that. And I want to introduce those right now. First of all, we have Dr. Matthew Macaluso. He is the Vice Chair of Clinical Affairs at the University of Alabama School of Medicine. He's a former program director and professor of psychiatry. And he's also the clinical director of the Center for Depression and Suicide at UAB. And Matt, it's a pleasure to have you here as a guest. And we also have Dr. Simran Sandhu, who is a current PGY3 in psychiatry. And he's going to talk to you a little bit about some of the strategies that can also be incorporated as somebody applying in the match. The statistics since 1952 for the match have gone up literally 5 times. 1952, it'd be interesting, there were only about 7,000 PGY1 positions. Now in 2024, there's 40,000. So, and also the applicants are 50,000, but it's gotten more competitive. Psychiatry, as you will see, has gotten extremely competitive. And in fact, we'll talk a little bit about that as well and some of the reasons why. But Dr. Matt, welcome. And, it's like, if you want, we can just start off with some of the first questions too, and maybe your experience as a former program director, but how can a candidate possibly secure a residency position, whether it's post-match or in future match? What are some things that you might want to keep in mind?
Yeah, thank you, Professor Heffernan, for including me in this panel and for your kind introduction earlier. It's always nice to see you, and Dr. Sandhu, it's nice to connect with you. And so I would say that for individuals who have gone unmatched for whatever reason, don't give up is the key thing. Because I can tell you, as a former program director, I was in the role for 10 years. There are candidates who match right out of the gate, and there are candidates that don't. And sometimes it takes people 2 or 3 or even 4 times or more to apply before they can get into residency. And sometimes it doesn't even matter what medical school you went to. I can list examples. Well, actually, I can't because it's confidential, but I can give you examples of people that went to some really top US medical schools that didn't match because they were given bad advice about which programs to apply to. Similar examples from people who went to other schools internationally. So everybody's situation is different. And I think you've connected with a really good organization in Residency Medical to help you figure this out in terms of your journey. But in terms of very specifics, there's the SOAP, which used to be called the Scramble, where any unmatched candidate can apply to unfilled positions. And perhaps if you are looking for, say, a psychiatry position or another categorical position, and there are no positions available in that specialty, you might think about doing a medicine year 1 or a transitional year as a way of getting some GME under your belt. I don't know that that's a one-size-fits-all prescription, but if you're unmatched and you do an internal medicine year, that can certainly translate into a residency program in another specialty down the road. You would transfer programs. Certainly bolstering your CV is an option if you're not going to be doing GME of any kind. I would say as a program director, when I see someone who's not matched before, I become uninterested in them when they've not really been doing anything since the time they were unmatched. Showing your interest in the field by doing volunteer work or even paid work in the field or research goes a long way to show your commitment. Doing externships or clinical rotations is one example of something you can do to bolster your CV and can get you great letters of reference, just like the research. And then reapplying and not giving up. I know of very good psychiatrists all across the country who did not match the first time around and wound up matching down the road and went on to have wonderful careers. So this is unfortunately a test of your perseverance. But again, you've connected with a great organization in Residence Medical to help with that.
I think those are great suggestions, Dr. Macaluso. I really appreciate that. Some insights also that sometimes the program you wanted to match into or that you didn't match into may be a positive thing, because the program you later match into may be the program where you really are a good fit. So, and sometimes it's hard to keep that in mind when the first time you out of the gate. Dr. Sandhu, tell me a little bit about, I'm sure you had classmates, friends and stuff like that who didn't match and had some experiences of what they were trying to do to get back into the game.
Sure. Well, I thank you very much. I absolutely agree with the doctor. From my experience, I went to a foreign medical school in Hungary, and it's a pretty unknown medical school. Nobody really knows about it. I tried to match. I tried it by myself. It didn't work. Finally, I hooked up with Residence Medical. So the first time around, I really wanted to do psychiatry. Okay, that was really on my mind. That was my dream since I was a kid. As we all know, psychiatry is very hard to get into these days. It's not like it used to be. It's the new, let's say, the new radiology. Everybody wants to do it, and so, but I had my heart on it. So first time around, Residence Medical, they told me, okay, listen, just get into a program. Afterwards, you can transfer. But I was adamant at that time. I actually was able, I was offered a program and I denied it. And my part, I kind of feel like that was a mistake, because they would have been able to get me a residency program in psychiatry afterwards. So a year went by and I kept on doing research. I kept on doing an internship, and I decided, okay, you know what, I'll try it. So they set me up with an internal medicine preliminary program. So I did that for 1 year. And then afterwards, I was able to transfer into the program of my dreams. So right now I'm a third year in psychiatry, almost done. And I've got the dream program. So it worked for me. You really have to have perseverance. You have to have hope and trust. That's really what's gonna get you through.
Yeah, that's a great point that you just brought there. And Dr. Macaluso, you were saying in terms of additional clinicals or staying current, one of the things I think sometimes candidates need to do is make sure that their LORs are updated regularly. As a program director, you're probably looking, you want to what, minimum 6 months or less, or even sooner? What's your take on that?
My rule of thumb for letters of recommendation would be within the last year. Anything that's older than that feels like a red flag. So for example, if you attended medical school 5 years ago and you have letters from someone at your medical school that you last worked with 5 years ago, that to me doesn't say much about what you're doing now. Now, if you want to have that letter, I think make sure that you have other letters that are more recent and more timely. And so that's very important. Now, sometimes folks will update these letters, especially if you've been in touch with them. Perhaps that person from 5 years ago is someone you keep in touch with and you've worked with on something or just had conversations with about your career. That can help you to update your letter. But I think within the last year, within the last 6 months would be better. But I think this is going to be something each program judges differently. And there's really no hard and fast rule. But I do think it raises a red flag if your letters are older, particularly if you've not worked with that person in some time.
Yeah. What about what Dr. Sandhu was saying, that if you have an opportunity maybe to go into a clinical specialty in a residency, PGY1, and your heart is set on another specialty, let's say for psychiatry like he was, and he had an opportunity maybe even to do a prelim, is it better then to take that 1 year, stay active clinically, and then try and reapply because things are a little bit more competitive? Each case is sort of different. Go ahead.
Each case is different, and there's really no one size fits all answer. I've seen people that have gone into a internal medicine or family medicine year one, or even a transitional year, and then transfer into psychiatry later. I've seen people that don't do that and just keep applying. And they're doing research or doing a clinical rotation while they're going through the match again. Personally, as a program director, if you are in another program and you're doing well in that program, that can help your application because you become a bit of a known quantity at that point. But again, everyone's circumstances are different.
Right. What are some suggestions for like networking or trying to, you know, make sure that you kind of stay in touch with programs or with students or other fellow students who may even hear about programs? Dr. Sanders, I'm sure there are situations where residents sometimes hear from another resident or candidates of an opening or something like that. But what are some networking suggestions, Dr. Macaluso, that would be good for that?
Yeah, I think put yourself out there is the best way to say it. And, you know, I do this now, and I'm a senior faculty member, a professor of psychiatry, and I'm always putting myself out there because you never know who you're going to meet and what kind of collaboration it's going to lead to. So build your network. And so the way to do that is to go to meetings. Going to this meeting is one thing you're doing to put yourself out there. Engage with the people on the call. Go to conferences and seminars, talk to people. It's not just enough to show up, but go shake hands, have good questions for people. You're seeing Professor Heffernan do it now. He's listening to the conversation and coming up with good questions. If you do that at a meeting and you do it in a meaningful way, you'll be recognized. Joining these professional organizations like the American Psychiatric Association. I'll also throw out a plug for the ASCP, which is the American Society of Clinical Psychopharmacology. Now, I'm on their board, so I have a conflict of interest, but if you're interested in psychopharm, it's a terrific organization, and a lot of residency leaders attend. Social media, and that's, again, more than just having your own LinkedIn or Twitter or whatever it's called now, but actually going on there and liking things and responding to things. So finding people that are residency leaders or that work at places you might want to match and commenting on things they post and asking good questions can put you on their radar. And alumni networks in some places is another example where you can contact people from your medical school. Perhaps people from your medical school are working at a specific institution and they can help you make some contacts. When I was recruited to UAB, it had nothing to do with my alumni network per se, but it was because of my professional network. I was a faculty member at University of Kansas for 14 years. A person I'd worked with for many years recruited me to UAB. Well, guess what? After I got here, within a couple of months, several other KU alums, University of Kansas alums, just reached out to me because they saw that I was in the area. So don't downplay or miss out on the impact of your alumni network. But the big thing is build your network. You're never going to know when you need them, and it cannot hurt to know people.
Those are wonderful insights. Thank you so much, Dr. Macaluso. One of the reasons people do come to Residence Medical is we have a fairly vast network, and we are national and affiliated with a lot of GME programs, as well as starting GME programs. And believe me, that network is very, very valuable for recommendations to different candidates. And when positions come up, there's usually a very good chance we may even know somebody who is connected to one of those or who may be even in residency there. And physicians like to hire physicians that they know have well recommended by other physicians because, you know, they're looking for a good doctor to train and a good doctor to become a future board certified physician. Dr. Sandhu, how about your networking? What would you imply for some of the new candidates for residency? What are some of the things they could do or your own experience?
Well, in my own experience, you know, one good thing you could do is if you're doing a research program, if you're in a research setup with Residence Medical, if you guys go to a meeting, you do a poster presentation, you can always, there's so many program directors there. There's so many residents there, you know, you get to know people. You really, the more you put yourself out there, the more chances you have of making good connections. I mean, for me, I remember I ended up winning a poster presentation. Because of that, I was able to meet a lot of different people. I actually met some people who are involved with my residency right now also. You know, but the main thing for me, I think, was really just to follow what Residence Medical was telling me to do. You know, they said, okay, why don't you apply, why don't you do some internship with these people, try and get yourself known? I mean, it's really getting into some sort of internship or research program and really shining, really making them see that you are a great candidate and that you are what they want for your program.
Thank you. Those are great examples. And I know of a number over the years. We've had candidates match in who won awards and presentations, poster presentations, research. And a lot of times some of the early candidates don't always appreciate that research and doing presentation and conference has great value. All residency programs must have scholarly activity going on. It's very, very important. And to see that and to be able to present that and even having that experience is very helpful for a future program that they may match into to help with their scholarly, their faculty, those residents. Yeah. So that's really excellent sharing about that. Dr. Matt, question. What would you say are some of the things that really impressed you as a program director of applicants and things that they did that you can think about over the years?
Mm-hmm. I think the biggest thing is having a CV and having a oral narrative in meetings that suggests you're very interested in psychiatry. The worst thing that I would see as a program director is someone that comes in, for an interview and they seem very enthusiastic, but then when you look at their CV, it talks about another specialty, or all of their publications are in another specialty. All of their letters are from doctors in another specialty. So I think it's being able to thread that needle through your work experiences, your research experiences, your personal connections, that you are invested in becoming a psychiatrist. Because the way I look at candidates is, provided you have the requisite knowledge and the requisite skills to get through residency, the rest is all personality. And if you are invested in psychiatric patients and invested in treating mental illness, you will do well in residency. If you are doing psychiatry or choosing psychiatry as a field for some other reason, whatever it is, I find that you will not do as well in the training, and it will feel like more of a chore than a career.
Right. That's a great insight. We hear that a lot too from different program directors. Mm-hmm. Being specific to the specialty when you're applying, you really want to see that, and the program director wants to see that. You know, it's and whatever the specialty is, you want to make sure that's focused. Dr. Sandhu, I'm sure you had a little experience of that because you shifted specialties and saw that was really important to impress the program director.
Absolutely. I'd like to add to the previous question. So one time, what I did was I was working with a doctor named Dr. Bailey. Dr. Bailey's a psychiatrist. I was helping him with a lot of different areas, but I got in touch because of him, I got in touch with a doctor in Meharry Medical College. So Dr. Bailey and I wrote a paper together with this other doctor. The doctor really liked it. So the doctor actually asked me, he said, would you like to teach a class? I said, teach a class? He said, yes, in medical school. So I ended up teaching a class for a semester in medical school. I'm sure that really helped my CV a lot. So Absolutely. That's one big thing about networking. It's whenever you get a chance, put yourself out there, try and do as much as you can with other people. So when it comes to your other question, it's very important. I know that I tried really, there was a transitional year program director also. I really tried to get close to him and really tried to impress him. I got two of the best LORs I could ever believe it. I could ever read. I still read them to this day. I mean, I hardly, they're really great LOR. So, I mean, if you do end up matching into another program, which, if that's course you need to go through, I really recommend it. You do have to really, you have to do your best. You have to make sure that they really like you, and so so they can facilitate you go into the new program. I think it's very important, of course.
Yeah. Great insights about networking too, and some physicians, especially your example, who have wonderful networks and really can help in the long run. Certainly, program directors see that you're a faculty at a medical school. That's going to enhance your CV. Last question, and then I think we'll go to some questions that are maybe being sent in. But Matt, what's your take on how psychiatry has gotten so competitive and so popular over the years? Because I know you've been a PD for 14 years, and now at UAB.
Yeah, Dr. Sandhu alluded to this. There was an article a year or two ago that said psychiatry is the new dermatology. And I think it's multifactorial. In my own career, I graduated residency in 2009, but in my own career, I've seen psychiatrist salaries go up exponentially. And that's one reason why it's more competitive. And I think those salaries have gone up because society is starting to see the need for psychiatry. And so we have less stigma in our society. I think third-party payers and our government is doing a better job of funding psychiatric care. And so it's leading to this renewed interest. I always hate to talk about lifestyle because if you really love what you're doing, it doesn't matter. I know surgeons who work 100 hours a week and they're energized by it. But psychiatry does offer what I think is a more civilized lifestyle, although don't quote me saying that. My next door neighbor is a cardiothoracic surgeon, and I don't have to run in and out of the hospital all night long like he does. But then again, he likes what he does, and so that's energizing for him. And so that is another piece. But I always tell people, if you are not interested in psychiatry and don't want to serve psychiatric patients, you may burn out, even though you have a great lifestyle, because you won't enjoy what you're doing. But I think for those that really love to be advocates for patients, to make a difference in society, you can't serve a more vulnerable population than the population of mentally ill patients. And it's just an extremely rewarding profession.
Yeah. Dr. Sandy, you want to add to that as a PGY3?
Oh, absolutely. I definitely want to add to that. I can tell you, my heart is in this. I love what I do. I go to work. It's the first time I really love what I do. I remember there's been times I've been driving home just yelling, "I love my life." It's when it comes to psychiatry, he's absolutely right. It's at times it can be difficult, but it's very rewarding. I mean, if that's your passion, you should go for it no matter what. I mean, for me, the hard work, the late nights, the worrying, it's all worth it now. I mean, it was a long road to get here, but I'm living my dream right now, and I'm almost finished. The future just looks so bright, and I mean, I'm so glad that I was able to go through all those hardships in order to get here. It was a long road, but it was definitely worth it.
Made you a better doctor, better physician, and that's really good. You also, in your specialties, you see patients that many of the other specialties do not, and situations with patients that most of the other specialties do not. And I know, Dr. Michael Lucy, you're part of an organization that helps do training for primary care doctors as maybe first responders to mentally ill patients, and how to recognize that and deal with that, which sounds like a wonderful organization that does that. Correct. Yeah.
I am working with ECHO, which is the Extension Community Health Outreach. So we didn't invent ECHO, the University of New Mexico did. And the idea is that you can take the expertise that you have at an academic medical center like UAB and extend it out into the rural community. So we get on a Zoom call once a month with 200 primary care doctors from around the state and now around the Southeast region. And we discuss depression. We talk about clinical cases in a de-identified fashion. We provide didactic instruction, and that benefits the patients in the community. So It's amazing the different things you can do in your career as a psychiatrist. That's just one example.
It's just wonderful. Let's take some questions because we've got a number of viewers here. So I'm going to read a couple of these here. This is from one of our attendees. Says, I've been trying to send an application to a particular college in Canada, but my application is not going through. And I was hoping maybe I may receive some help in my application. So I guess in the application process, somebody's having some difficulty. As a general rule of thumb, what is your advice in terms of applications and making sure that they go through? Dr. Macaluso?
Does Canada use EROS? As that question was being asked, I was thinking, I'm not sure how much help I can be because I think it's a different application system. But is this EROS or is it some kind of another application? I'm just not very familiar with Canadian training.
Yeah, it looks like that's a little bit unique on that too. We have a question too from somebody who's viewing. They're saying, Dr. Sandhu, do you have any specific literature searches or experimental research that you've come across which a person might be able to write a paper with? Is that a good strategy? Is that something that somebody should consider?
I think it's a great strategy. I've worked with a couple different psychiatrists before I came out here. Working with Dr. Bailey was great. I got a lot of public. He really writes. He's very prolific, so I was able to write so many things with him. A great thing to do would be maybe if you are doing an intern year with somebody, a sub internship with somebody, or doing research. Maybe talk to one of the residents. Maybe talk to one of the residents and ask them, "Hey, would you like somebody on your research paper?" Something like that. Really, more when it comes to networking, But I know that Residence Medical does offer a lot of research programs where you're working under a program director or you're working under somebody else in the faculty where they end up giving you a lot of different opportunities to be in research. And I think it's important, especially in psychiatry, just having that CV, as the doctor said, really showing that this is what I'm very interested in. I know that my CV is full. It's full of all psychiatry. And that's what a program director really wants to see. Is this person's heart really in psychiatry? Are they doing it for the money? Are they doing it because it's maybe an easier residency, because of this or that? They really want to see, okay, does this person really love psychiatry? Is their heart going to be in it? Are they going to want to learn? So yeah.
Another question here from a viewer that they're a US IMG who applied for residency for a couple of years and they didn't get in, so they went and got a master's. Now, what's the advice if they get a master's or an MPH or something like that? Do they have to be very clear about staying active clinically if they reapply for the match? What would be the advice on that, Dr. Macaluso?
Yeah, I would be honest about the reason that you got the MPH. I mean, I think it's okay to say that, you didn't match, and because you didn't match, you thought that getting some additional education would be good, but then have a clear reason why you did the MPH. So, this MPH will help me as a psychiatrist in this way. Perhaps it is that you're interested in being a practicing clinician, but you also have an interest in public policy. And perhaps you want a small slice of your career to be looking at public policy. But the way to best be informed about public policy is to be a frontline clinician with your boots on the ground. But I think even more important than that, to have something you learned from the MPH program that's helping you. So I think the last thing you want to do is bring up one of these things and not have the ability to talk about it and not have the ability for it to make sense. It all just has to fit into your larger story.
That's great advice. In other words, focusing on how that creates a better candidate for you, especially for that specialty specific. And I think that's something that we've underscored here too. When you apply, if it's internal medicine, make sure that you are focused on that for the application. If it's psychiatry, that it's psychiatry. If it's primary care, family medicine, that it's there. General surgery, et cetera, despite the competitiveness. Yeah. We have a question here by somebody said, in FRIDA, sometimes they list the minimum step scores. If you're below that minimum, should you still try and apply, still try and contact Any advice on that, Dr. Macaluso, as a program director, and Dr. Sandhu, I'll ask you as well.
We never had USMLE or COMLEX cutoffs when I was a program director, so I don't know that I'm in the best position to give you an answer, but I think if programs are clearly saying that this is a cutoff, I think you need to respond to it in some way. And so if it were me, I would probably reach out to the program proactively. I would start with the coordinator. They're always great. If you could get a coordinator on the phone and willing to talk to you, you might learn a lot. So you could always email the coordinator and say, hey, I noticed that there's this cutoff and I'm below it. Can I still apply? Now, I think you should have some reason why. Is it that you're just barely below it and that the community is one that you really want to be in, and why? I don't think it should be, well, I'm below the cutoff, should I apply? There's got to be some detail. By how much? Is there a reason we should grant an exception? What's your link to the community? There's got to be some compelling detail there.
Dr. Sandhu, thoughts?
Yeah, well, I could tell you about my own experience. I mean, my step one back when I took step one, there was a score, and that was the most important step. It wasn't a stellar number. I mean, it was pretty mediocre. I mean, with that, I passed my step two first time. It was an okay number. Actually, I failed step three once, and so that really killed my hopes. But because of the networking that you guys do, Residence Medical, you guys were able to overcome that. I did, because of the research, because of all these other things, I was able to fill in a little of the gaps and equal out the balance a little bit because of my step scores. So I know that if I tried to do it on my own, I would have been hopeful to get maybe a family medicine program, maybe pediatrics, something like that. But psychiatry would have definitely been beyond my reach. But I think because of the other research I did, because of the networking, because of also I was able to go into a internal medicine program, and that's a demanding program. If a PD hears, okay, well, he did well in an internal medicine program, you're probably going to do well here. I was lucky enough. I even got a PGY2 after my first year intern years. So I was thinking I'd get being a PGY1 again. I would do that in a minute, but I was so lucky I got a PGY2 position. So I'm happy. I'm grateful. Yeah,
that's great. One of the things that we sometimes look at too is we'll see people who have literally given up and under situations where we've seen many people who under the same situation didn't give up and eventually got into residency. As you well know, Dr. Sandhu, too, some people might say, yeah, I'm just not getting in, I'm going to retake this step 3 and da, 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 da. But, I've even talked to some US grads who didn't match first year out, first or two, and didn't just figured, I'll have to do something else. But there always is a opportunity if you don't give up and continue on with that. We've got a few more questions here. Personal statements. So a question about that. How much impact is the personal statement in applying for, let's say, psychiatry, Dr. Macaluso? What is your take on that as a program director?
We do, as a committee, read those statements. I was the program director at Kansas, so I led the recruitment committee. I am the vice chair here, but I'm still on the recruitment committee. And I can tell you at both places, there were people that very thoroughly read those personal statements, and, grammatical errors or problems with the writing would be red flags for those folks. But probably more importantly is just an interest in the story. You have this statement, this ability to tell us something. What are you choosing to tell us and why? I think you've got to think about that in the context of your own personal experience and how it fits into the larger narrative of wanting to become a psychiatrist. But I think you should avoid retelling your personal statement in the interview. I've never liked that because, I've already read it, so I don't need to hear it again. But I think being very intentional about what you put in the personal statement is important.
Dr. Sandhu, I know you spent a lot of time on your personal statements and you had to do them for multiple specialties, obviously, correct?
Yes, I did. For my psychiatry personal statement, that really just flowed out. I really just showed that, this is a passion I've had for so long. The program directors, like I said, they really want to see, does this guy really want psychiatry? Do they really want it? I mean, for me, it was so easy for me to write that one. I was able to, give experiences from my life, reasons why I want to get into psychiatry. I mean, so for me, yeah, I think it's probably a very important thing for program directors to see, okay, does this person really, what is this person being genuine? Is this really their passion? I mean,
yeah. Every year, there are post-match opportunities for applicants. And we've, over the years, as Residence Medical, have had the experience of guiding residents into residency positions starting in July, August, even September, and even as late as October. Sometimes there are some off-cycle positions as well. I think what you guys are talking about in terms of networking and staying in touch is these are good strategies in case opportunities like that come up where a person is, at least they're engaged because they may hear about, oh, this particular program has an opening for a PGY1. It's a later start, but you can either catch up or you will, you'll just end later with residency. But Dr. Matt, you may have had some, late starters while you were a program director or openings that happen for various reasons. Share with us any of those examples that you had.
It didn't happen often, but we had a situation once where someone couldn't start the program because of a licensing issue that we weren't aware of. And so we wound up having an open spot. We, every once in a while, there'll be someone in a program that decides to move on from the program. And, that creates an open spot. We didn't always fill those slots. Sometimes we did. Taking transfers can be somewhat risky. It depends on the situation of a transfer. Someone who did an internal medicine year one that did phenomenal in the program and they've got glowing letters from their program director and they just always wanted to do psychiatry feels like a slam dunk, but someone that's leaving another program for other reasons is a different story. So occasionally there'll be open slots and occasionally people fill them. Were you also wanting to know about people who start after July? Was that the other part of your question?
Yeah.
Yeah, at KU, we actually had a policy that people had to start by a certain time. And I think it was September was a requirement. And so usually we were able to do that. But talk to the program director, talk to the coordinator, get an understanding of what the rules are and why you need to start late and hopefully the program can work with you. But we did have a rule on that with September.
Yeah, which is still a couple of months away here, or, to do that. Dr. Sandhu, I'm sure you heard about different openings that came up. That's been your experience, and you still probably hear about that as well.
Well, that was what my experience was. Even the first time when I was offered the family medicine position that I ended up turning down, I believe it was in July, and one of the residents had to leave, and I had done 1 month at that program. I really shined. They liked me there a lot, so they asked them, "Say, oh, what's with this candidate?" So I got the phone call. I said, "Hey, well," they said, Residence Medical asked me, "Do you want to take this position? Another resident has left." At that time, I didn't want to. I was so adamant on psychiatry, as I said earlier. And then the same thing happened when I got my preliminary program. This was after match, I believe it was around at the end of June, early July when I got that acceptance. So that's when I said, okay, you know what? I'm going to do this. I'm going to put my foot in the door. That was the most important thing. I didn't want to take too many years. It'd been already the years that passed since I passed medical school. Every year that passes, it makes it harder to get in. And then once you put your foot in the door, you're already in the system. And when you're already in the system, if you can shine in that system, then it's worth a lot more. You want to be able to be doing something, and especially if you're doing something in an ACGME accredited program, that's worth a lot. So, yeah, I mean, I know that residence medical has a lot of positions opening up after match, even in the summertime. So
They do, and we will be seeing those over the next 2 months through the summer. We've got another question here from one of our attendees, which sort of been answered, but is it bad to have LORs from other specialties when you're applying for another specialty? Or can you have maybe one? What's the rule of thumb on that, Dr. Matt?
In my opinion, it's nuanced. And so I wouldn't say, no, you can't have letters outside of psychiatry, but I think you have to have psychiatry letters as well. So let's say you had 3 letters. I would personally like to see 2 of them as psychiatry letters. And if the third one is from another specialty, that's fine. But that, third letter would really need to talk about not only how you did in that specialty, but your interest in psychiatry and why they think you'd be a good fit for psychiatry. If you have more than 3 letters, I'd think about it in the same way. You're going to want at least 2 of them to be from psychiatrists. And then the other 2, you don't want them to say, well, Dr. So-and-so will be a great radiologist one day. You really want those letters keyed into your psychiatry application.
Dr. Sandhu, any addition to that?
Yes. When I did ask for my LORs from my program director, the transitional year program director, I made sure that they put in there, dear, that he will be a great psychiatrist. I made sure that they put that in there because, I was getting in 2 of my LORs. 2 of my LORs were from internal medicine program, my internal medicine program that I was in. One of them I got from somebody I was researching with, but 2 of them were internal. And I figured, it's much better to get a LOR from your program director that you're with. And also I was able to reach the transitional program year director that I was working with. But I made sure that they mentioned that I would be a great psychiatrist, that's what I'm interested in. So you want to make sure that they put that in your LOR.
Right, absolutely.
Yeah.
We mentioned scholarly and research. We got a question here from somebody too. They said, are some research publications considered more valued than others? And is that something to consider, Dr. Matt?
It depends on where you're applying. So if you're applying to our program on the research track and you have high-level publications in psychiatry, original data in a high-level journal, that will get noticed in the research track. If you're applying to our general track, that really doesn't matter as much. It helps, but it's not going to get you as many points. So I think it's nuanced. Now, maybe if you're applying to Yale, it's different, but at least here on the research track, a higher level publication will get you more points. It's not like it will get you 0 points on the regular track, but it's not as big of a deal in the regular track.
Yeah. Is that your experience also, Dr. Sandhu? Because I know you did some significant research and some great work with Dr. Bailey.
Yes, I did. Well, I know that my CV was full of research, and I'm sure that helped me a lot. I was able to, I must have had at least 7, 8 different, nothing in a major journal or anything, but there were some publications. I know that I did get that best, I got best poster awards. I'm sure that it really did round out my, it tipped the balances in my favor. And you want to do anything you can to make yourself a better candidate, and showing that, I've done all of this research in that field, especially psychiatry, will show you the program director, okay, this is somebody who's very, very interested in that. They spent so much time with doing research, trying to, I think that the research track with my program, I think getting into my specialty, I think that it really showed that even though I'm in internal medicine at the time, psychiatry is what I want to do, because it was just full of psychiatry stuff, even though I was in an internal medicine program. So
good. Maybe last question. Okay. This one's kind of interesting because it does come up. We have a viewer who is in residency, but the residency program is going to be losing its accreditation next year. So this is probably more of a question to you, Dr. Matt, because you may have been aware of this. So at this point, do, and they've got an NRMP waiver and stuff like that. When a residence program may be losing accreditation, what happens to the residents at that point in those situations?
If the program does the right thing, which they may be required to by the ACGME, the program should be trying to help you find a position somewhere. And so if you're a third year or fourth year, it may be a little easier because there are always programs that lose trainees to child. So there may be open third or fourth year spots. If you're a first year or second year, it may be more difficult, although there are new programs out there that didn't fill. The challenge is you may have to relocate. You know, the story that's out there, you can find a lot in the public domain. In fact, the book that I published on GME and psychiatry talks about this, but Drexel with Hahnemann Hospital, when the hospital closed, they helped the residents find new positions elsewhere. There are some other examples that aren't in the public domain that I won't name, but I believe the program should be helping you with that. But I wouldn't put all my eggs in one basket either, because they may not do a good job. I would be searching for open positions myself, ideally in the same area, because people will know about what's going on.
Yeah, and relocation is often the situation where you have to do that. If the positions go up, usually there are other institutions that want to acquire those spots as well. And normally, and from what I have seen or heard over the years, is the residents do end up matriculating to other programs. I don't know if Dr. Senda, if you've had that experience or aware of some programs that closed, and what happens to the residents in that situation, but they usually are able to find a home. It's just probably not where you're at, and that's an inconvenience, you know, for the trainee overall. Which kind of brings us to a close here on that particular set of questions. I want to thank both our panelists for their great insights on trying to either stay more competitive, trying to network, trying to see if maybe even 2024 in the next 2 months may still be a possibility as you go through and continue to get more competitive. If you have other questions, feel free to contact us here at Residence Medical. We're here to help. We do have quite an extensive network, so we're very aware of those needs. And we work with a lot of candidates every year to help and assist them and guide them to becoming great trainees, maybe future chief residents. We get a few of those, which we're very proud of, and board certified doctors in a specialty that they love, as Dr. Sandhu is a wonderful example of. My wish is that you all, you know, as you're driving home from your work, say, I'm so happy and I love this specialty, because at the end of the day, I know, Dr. Matt, you want physicians to be in specialties they really like, correct?
Yep. Absolutely. That's where they do the best work. So
yeah, that's it. Thank you so much, gentlemen, for all your great work that you're doing right now. And you're an inspiration to all of us and all of our viewers. And hope you have a great week, and we will be in touch in the future.